excuse me, I got choked up here. November is National Epilepsy Awareness Month, and according to the CDC, almost 3 million American adults have epilepsy. And with healthcare costing billions for the neurological disease, people with epilepsy can have a really hard time getting the medical care they need. Joining me now is Dr. Pooja Patel, the director of the Epilepsy Monitoring Unit at Marcus Neuroscience Institute. Dr. Patel, thank you so much. I'm sorry, getting choked up here, goodness. Talk a little bit about what is epilepsy. What happens to someone's brain when they get this?
So epilepsy, a brain disorder, is also known as seizure disorder.
Sure.
A person is diagnosed as having epilepsy after they've had 2 or more unprovoked seizures. In their brain, there is abnormal electrical activity at the time of a seizure, which can cause a lot of different physical manifestations. They can have change in behavior, they can have change in their level of alertness, change in level of consciousness, and also loss of bodily control.
And so I've heard, just talking about that, I think a lot of times perhaps you have an image of what a seizure looks like, but a seizure can actually be something that's very calm, right? I mean,
seizure has so many different presentations, so it could be that seizure is not always obvious to someone who is looking. It could be where they're just having staring spells. It could be where they're having minor twitching that, unless you really have a history of it and are familiar with it, can't recognize it.
Talk a little bit about how it's treated. If all of a sudden you find out that, okay, you have epilepsy, it might be kind of a scary diagnosis.
Yeah, so luckily now we have a lot of treatment options for epilepsy, and it is still primarily treated with anti-seizure medications. About 60 to 70% of patients have success with anti-seizure medications alone, but there are 30% of population that does not respond to medications. In that case, we look at other options like epilepsy surgery or neurostimulation.
And so what happens if you go untreated?
So it can be very dangerous if seizures are left untreated. So for example, a generalized tonic-clonic seizure that we usually are aware of as like a grand mal seizure, if it is left untreated, it can cause trauma, can cause choking, can cause aspiration. But then overall, chronic epilepsy, if it's left untreated, can have a lot of complications such as memory impairment, psychiatric illness. Long-term, untreated, or even poorly treated epilepsy can increase your risk of SUDEP, which is sudden, unexpected death in epilepsy.
And can you talk a little bit about, are there certain people that are more prone to having seizures and having epilepsy?
So there is a bimodal age distribution, which is common in children and older adults. So in children, because of genetic causes, it could be because of brain abnormalities like developmental brain abnormalities and infection. And in older adults, it's because of structural brain abnormalities, so which can be from stroke, dementia, brain tumor, or traumatic brain injury.
Is it something that's hereditary?
It could be hereditary. There is a genetic link to it.
All right, so if you have some concerns or interests, you just talk to your doctor. They can point you in the right direction. Doctor, thank you so much for enlightening us, giving us some information, something to look out for. If you'd like to watch this interview again or to learn more, you can go to our website. Just search Epilepsy Awareness. It'll take you right to a website for more information and more resources. Vanessa?